Well, we were talking about different types of chronic conditions that can occur in the older adult, and it can be one, it can be multiple ones, multi-morbidities there. And that can come in the face of acute illnesses, chronic conditions, medication effects, and so on, the list that you see there. We're going to focus on one chronic condition. Diabetes mellitus, or as some people say, diabetes mellitus, is one of the most common chronic conditions that exists, having its highest prevalence among Native Americans, Alaskan Natives, African Americans, and the Hispanic population. In fact, Pacific Islanders and American Indians have the highest rates among all five of the racial groups that are counted in the U.S. Census, more than twice as likely to have the condition as white people, who have about an 8% chance of having it as adults. And it's also more common among African Americans and Asian Americans out of the three. And researchers are studying the different factors that could make diabetes more common, but so far they've really looked at a few things that can account for the difference. Being obese seriously raises the chance for type 2 diabetes, depending on the percentage of body fat. The World Health Organization says Asians tend to have slightly more body fat than whites of the same height and weight, and also carry more of it in the belly. And it's considered that deep fat is more harmful than the fat under the skin that you have on buttocks or thighs, because it can make you more resistant to insulin, which keeps blood sugars levels stable there, and that can cause hyperglycemia. So diet and lifestyle can have a difference there. They found that once foreign populations that had healthier lifestyles, had lower incidences of type 2 diabetes, are now experiencing greater amounts as their diets become more Americanized. What was once thought to have perhaps a high bearing has kind of gone back down to a low likelihood now, but that being genetics. For all the differences across races and ethnicities, they found that genes really play a small role in diabetes risks, and that the same habits and conditions that raise the chance of becoming diabetic apply to everyone, no matter the background, though. But comorbidities for older adults are really an essential playing factor in whether or not they attain diabetes mellitus. So some goals for diabetes treatment, if they are diagnosed with it, is, of course, to treat the hyperglycemia and work with the comorbidities. One of the risk factors that's shown here, sarcopenia, which is a loss of muscle tissue, is a natural part of the aging process, and that's what can lead to insulin resistance. But as you might guess, other additional risk factors, cognitive impairment, depression, incontinence, falls, and multiple medication usage there, provide additional risks for attaining this disease. Kind of some scary statistics. When you're looking at insulin resistance, it's an impaired response of the body to insulin, resulting in elevated levels of blood glucose, which is a key component of type 2 diabetes and also of metabolic syndrome. In addition, the pancreatic islet dysfunction results in increased glucagon secretion by hypoglycemia, so the body stops adding any sugar to ward off low blood sugars, so those episodes can actually be more common. Look at the statistics, though. In 2004, 23% of people who were 65 years of age or older had type 2 diabetes. And more recently, that number has increased to 33% with type 2 diabetes. And they're estimating by 2040, we could see double what was the rate in 2004. And again, the older adults come at a little higher risks because of decreased insulin resistance and pancreatic islet dysfunction that occurs as a normal part of the aging process. To many, I should say, very minimal degree, but to some, a greater degree. Some other common complications of diabetes there can result in kidney disease, loss of vision, especially diabetic neuropathy, which we spoke about earlier, and the others that you see here as well. It also makes them more prone to serious complications from the flu in those over 65 years of old, because diabetes and age actually weaken the immune system, making you less able to fight infections like pneumonia. bronchitis, sinus infections, and ear infections, and more serious ones can actually lead to hospitalization and even death. And the flu can also make diabetes worse with hypoglycemia, can affect the appetite, leading to hypoglycemia. So it becomes kind of a vicious circle. And then there's newer studies that are linking poor blood sugar control to increased incidence of Alzheimer's dementia. That's it, huh? That's it. Thanks a lot for joining.